Hey everyone, welcome back to the channel. Today we're going to talk about oral fibromas. They're super common, but they can sometimes trip you up if you're not totally clear on what they are and how to handle them. So let's dive into it. All right, so first off, what is an oral fibroma? Well, it's like a benign hyperplastic lesion, basically an overgrowth, that happens when the oral mucosa gets exposed to chronic mechanical irritation or trauma. That's why some people call it an irritation fibroma or traumatic fibroma. It's your body's way of like reacting to constant biting, cheek chewing, or even rough dental appliances. Now, when it comes to who gets them, they can really show up in anyone, but um, they're most common in adults, especially people in their 50s and 60s. And like there's a slight female predilection, but it's not a huge difference. So, clinically, how do these fibromas present? Well, they're usually like firm, smooth surfaced nodules. They're often asymptomatic, which means patients might not even notice them until you point them out during an exam. Most of the time, they're sessile, meaning they've got a broad base, but sometimes they can be a little pedunculated, like on a stalk. Color-wise, they're generally pink and match the surrounding mucosa, but um, depending on keratinization or if there's been trauma, they might look lighter or even darker. The most common spots, the buccal mucosa along the occlusal line, the tongue, and the labial mucosa. Now, histologically, let's nerd out a bit. These guys are made up of dense fibrous connective tissue that's covered by stratified squamous epithelium. You'll usually see like hyperkeratosis and acanthosis, especially if there's been chronic irritation. The connective tissue is mostly collagen bundles with scattered fibroblasts and not a lot of blood vessels. All right, but here's where it gets interesting. Differential diagnosis. You got to keep a few other lesions in mind just so you don't like misdiagnose it. First up, mucoceles. They're typically fluctuant, bluish, and like usually on the lower lip. Then there's lipomas, soft yellowish, mobile, and usually asymptomatic. Pyogenic granulomas are red, ulcerated, and they bleed really easily. Peripheral ossifying fibromas, they're more of a reactive gingival lesion with some calcified material in there. And giant cell fibromas, they're Derivaticulobephroma. They've got these multinucleated giant cells and show up more often in younger patients. So, like, how do we diagnose it? Most of the time, it's clinical. History and exam give you a pretty good idea, but to be like totally sure and to rule out other stuff, it's best to do an excisional biopsy. Management wise, it's pretty straightforward. Complete surgical excision is the go to. You want to make sure you get the base of the lesion to prevent recurrence. And don't forget to eliminate the source of irritation, like rough fillings, sharp teeth edges, or cheek biting habits, so it doesn't come back. Prognosis, honestly, it's excellent. Once you take it out properly and get rid of the irritation, it almost never comes back. Prevention is all about addressing those habits like cheek or lip biting and making sure dental appliances fit well. And regular dental checkups help you catch these things before they get too big. So, yeah, that's your deep dive into oral fibromas, what they are, what they look like, how to diagnose them, and how to manage them. It's one of those bread and butter topics that you'll definitely see again and again. So make sure you're comfortable with it. If you found this helpful, give the video a thumbs up and subscribe to Dental School for more videos like this, just solid academic content that like actually matters. I'll catch you in the next one.